Good morning, sir. I am Mika Bernabe. For today, I will be demonstrating the proper way how to care for the newborn at birth. Before doing the procedure, we need to gather the equipments needed. Here is the identification band for the baby, the dry clean linen, and the baby's bonnet. Two pair of sterile gloves, two sterile gum, sterile scissors, kidney basin, cotton balls, erythromycin eye ointment, vitamin K, and hepatitis B vaccine. So all newborn require essential newborn care to minimize the risk of illness and maximize their growth and development. Warmth, normal breathing, mother's milk, and prevention of infection are the basic needs of a normal baby at birth. These basic needs indicate that the baby's survival is totally dependent on the mother and other caregivers. Therefore, it is important to provide proper care to all neonates immediately after birth. This will prevent many newborn emergencies. So after gathering the equipment, you need to perform hand hygiene to avoid the transmission of microorganisms. Next is the newborn identification and registration. So newborn identification is important because there always the possibility that the baby is handed to the wrong parent, be switched, or kidnapped from the healthcare facility, though these events are rare. Newborn identification is an important nursing responsibility. Nurses must be certain the infant has an identification band in place for the medicine administration and performing procedure to be done safely. So the identification band is a plastic bracelet with a permanent lock that requires cutting to remove it. The information printed on the band includes the mother's hospital number, mother's name, the sex, date, and time of birth of the baby. Baby's footprint may also be taken for identification. Next is the birth registration. So, birth registration include the infant's name, of course, the mother's name, the father's name, if the mother chooses to reveal it, and the date and place of birth of the baby. This official information is important for eligibility for school, voting, passport, and social security benefit. So, after the newborn identification and registration, we will go to the procedure, which is keeping the baby warm. So, we will do the KMC or the kangaroo mother care. So, after wiping the baby, we will place the baby on the mother's chest and abdomen between her breasts to provide skin-to-skin contact. And then we will put on the baby's bonnet. And we will also put on a dry clean linen on the baby to keep the baby warm. So the benefits of the kangaroo care to the parents include the providing bonding with the baby and the feeling of closeness, increasing the breast milk supply of the mother and her confidence in the ability to give care. Place the newborn on a radiant warmer. This is a body warming device that provides heat to the body. The heat loss in newborn is rapid, hence this body warming device provide an artificial support to make the body temperature constant. For getting the body temperature of newborn, it is recommended to get in the axillary area rather than rectal. Let's move on to the promoting adequate breathing pattern and prevent aspiration. A crying infant is a breathing infant. Typically, a newborn takes 30 to 60 breaths per minute. This can slow down to 20 times per minute while they sleep. So, for the resuscitation of the newborn, this is performed to the newborn who does not breathe spontaneously or may take a few quick gasping breaths but unable to maintain respiration. Next is the suctioning. The suctioning of the mucous secretions on the mouth and pharynx before the first breath using the syringe valve or suction catheter. Next is the intubation. Intubation may be performed to meconium-stained infant for deep tracheal suctioning before the first breath to prevent meconium aspiration. And then, administration of surfactant. This may also be helpful to assist breathing. Let's move on to the inspection and care for umbilical cord. So before doing this, we need to put on the 2 pairs of sterile gloves. So during pregnancy, the umbilical cord is the lifeline to the baby. However, after birth, this isn't required anymore. So there are several risks associated with delayed cord clamping, including hyperbilirubinemia or the so-called jaundice, and then the polycythemia and respiratory distress. So, these are the steps for cutting the umbilical cord. Always remember that cutting the umbilical cord is a painless procedure. Before cutting the cord, we need to make sure that the cord is stop pulsing, so we need to palpate it. Okay, so let's palpate the umbilical cord. Always remember, we need to avoid milking the umbilical cord. So, after palpating it, we need to clamp the cord using the sterile cord clamp at 2 cm from the umbilical base. Okay. And then, clamp again at 5 cm from the umbilical base. So, after that, cut the umbilical cord just after the first cord clamp. You will use a sterile scissor in cutting. And then, wrap the cord to the scissor and then place it in the kidney basin. Okay? After that, we need to remove the first pair of gloves. So, the umbilical vessels should be counted and noted immediately. The cord falls off at about 7 to 10 days of life. Always keep the cord dry. Wipe the cord at each diaper change and then fold the diaper just below the level of the umbilical cord. After the cord falls off, a small pink granulating area, a quarter-inch in diameter, may remain. Let's move on to administering eye care. We will administer erythromycin ophthalmic ointment. This is to protect the baby from an unknown gonorrhea infection in the mother's body. After that, let's move on to administering vitamin K. So, administering vitamin K, this is to prevent low level of vitamin K and vitamin K deficiency bleeding. Okay, so this is a vitamin K 0.5 ml single dose to be administered intramuscularly at vastus lateralis. Okay, next is administering hepatitis B vaccine 0.5 ml to be administered intramuscularly at the vastus lateralis on the left leg of the baby. So, the first dose is administered within 12 hours after birth. Then, the second dose, 1 month old. And the third dose when the baby is 6 months old. Okay? So, if the mother is positive for the hepatitis B surface antigen, the infant needs to receive a hepatitis B immune globulin. So, this is the care of a newborn at birth. Thank you.